This video will detail sizing and application of the ProCare XTEND 174 cervical collar. For additional information, please refer to the instructions for use found in the packaging. Sizing is based on 6 adult phenotypes to ensure proper fit and optimum immobilization. Does your patient have a tall and long neck? The tall cervical collar is normally used on younger patients and those with a swan neck. Regular. Is your patient a mature female or thin male? The regular cervical collar is one of the most commonly used cervical collar in the product offering. Short. Is your patient an adult male or short neck woman? The short cervical collar is the other most common used cervical collar in the product offering. Stout. Does your patient have a very large neck circumference? The stout cervical collar is normally used on obese patients and/or no neck patient. Extra small. Does your patient have a short and thin neck circumference? The extra small cervical collar is normally used on female patients who have a short neck height and small neck circumference. Super short. Does your patient have a chin on chest neck? The super short cervical collar is normally used on obese patients and/or no neck patients. For adult sizing, you can use the sizing guide to determine the appropriate collar size by measuring the vertical distance from the tip of the chin to the top of the shoulder. Or alternatively, you can also use your fingers to measure the vertical to chin shoulder distance. If the patient is in between two sizes, try the smaller size first. At least 2 people are required when applying the brace. One to maintain the position of the patient's head and neck in proper alignment, and the second individual to apply the collar. Make sure the patient is lying flat on the table, removing any pillows from behind the patient's head, and position the patient to be centrally aligned with arms to the side. Slide the back piece under the patient's neck and center it. Ensure the black-gray foam padding extends beyond the edge of the plastic. Flare the sides of the piece out. Slide it up the chest wall and scoop it up under the chin. Sides of the collar front piece should be oriented up, off the trapezius and toward the ears. Apply the hook and loop strap and secure the opposite side of the collar in the same fashion. Tighten the straps alternately, one at a time, to an equal length on both sides. Make sure the front piece edges of the collar are tucked between the neck and the edges of the back piece. Please note that the collar application must be secure to ensure proper fit, maintaining prescribed alignment, and to prevent the chin from slipping inside. If the patient can slip his or her chin inside the collar, it is a clear indication that it is not snug enough. To fit the collar to a sitting or standing patient, with the patient in a neutral head alignment, slide the front piece of the collar up the patient's neck and properly position the chin support. Sides of the collar front piece should be oriented up, off the trapezius and toward the ears. Hold the front piece firmly with one hand. Place back piece under the crevice of the neck. Apply the hook and loop strap and secure the opposite side of the collar in the same fashion. Tighten straps alternately, one at a time, to an equal length on both sides. Make sure the piece edges of the collar are tucked between the neck and the edges of the back piece. The angulation buttons may be used to fine-tune the fit of the collar for anatomical conformity and pressure distribution. It is easier to adjust the angulation buttons if you first remove the collar. Chin support positioning. Slide up to help relieve chin tip pressure discomfort. Slide down to help relieve jaw pressure discomfort. Slide up to help relieve occipital pressure discomfort. Slide down to help enhance extension control.